Hi everyone, my name is Daniel Stone. I'm making this video as a small document to show my thoughts based on what I've seen with Obamacare and personally my opinions on it. I won't go much into my opinions based on it. However, I have noticed that for the majority of people that I've talked with, their premiums have gone up, not down. Their copays have gone up, not down. But yeah, their monthly premiums for the most part have gone up. Maybe stayed the same, but things have changed. Whether it's benefits have gone down, maybe gone up in some cases. But there seems to be a lot of confusion based on the options that are out there, at least here in California, that I've experienced. Yes, there's the Covered California website and there's others, but I read today that Aetna is dropping out of, I think it was 11 of 15 states. And it made me think, you've been thinking, this is me thinking to myself, you've been thinking about this for a while, why not share your ideas with everybody else? I'm not here to get people's opinions, I'm just here to state my own. So without further ado, basically my background is not in the medical community. I am not a physician, I am not a nurse, I have no formal medical training. However, I do have an interest in seeing people remain healthy, myself included. I am currently a little overweight, but that's my issue and my burden to bear. But I wanted to share this with you because I've seen a lot of people lose coverage or choose to not carry coverage for themselves in terms of medical insurance. Or they've chosen to stay within a job simply for the medical insurance because it's lower cost to them, but their employer is still bearing much of the financial burden. So I'll just be perfectly honest. I do not currently have medical insurance. The main reason for that being is cost. The last time I looked on the Covered California website, it was going to cost me somewhere in the range of $150 to $200 per month to get what I feel is the amount of care that I feel is decent, with a low enough copay, but also with a low enough deductible. I have had an idea rolling around in the back of my brain for a number of years. I've run it by my dad, who is a physician. My father is a physician for over 20 years now. Has worked for a large medical corporation, no longer works for them, but has been doing more freelance work, I guess you could say, in the last few years. But I've been able to see things through his experiences, work-wise, and also form some opinions based on how I feel things could be streamlined and also certainly improved. So basically, these are just my thoughts on the idea. I like to keep things as simple as possible. I like things streamlined. I wish our tax system could be a single-page tax form for the majority of us, like myself, who might be independently employed or just working a regular job and not have a huge amount of write-offs and things to want to deduct. If we could just check a couple boxes and it be confirmed with what our employer is stating, it would be much, much more simple. But unfortunately, that's not the way it is, but that's a whole nother issue. So basically, I have a desire to keep things simple, and I think a lot of other people enjoy simplicity as well, even though we live in a very complex world now, and it's seemingly more complex. I would like to see healthcare not be something that people are needing to really choose to have. I think it should be a choice, whether somebody wants to carry it or not. I have chosen to not carry it. Even though I can't afford it, I've chosen that I would rather save the money every month that I'd be otherwise putting into premiums that I will not be getting back if I do not use, than pay it out. Yes, I am taking a risk. I'm fully well aware of that, but I have chosen to take that risk for the last number of years. This last year, 2015, I paid a penalty, a government-mandated penalty for not carrying health insurance for the majority of the year. And frankly, I think it's a slap in the face to freedom as a whole. And that's something that we here in the United States I think we take for granted, the freedoms that we have many of the freedoms that we have. I think that we've written off a lot of our personal security. Well, we've exchanged liberty for the sake of security. So I just wanted to share this video in regards to my thoughts on the matter. When it comes to health insurance, I think it should be simple because it makes individuals, the ones that's actually making the decision, not some government politician or someone who knows better than you to make the decisions for you as to what you should be able to choose for what you want for yourself and for those that you love. If you're a father or a mother or brother or sister or a caretaker and you are in charge of other people's health and welfare, I think it should be well within your rights to choose exactly what you want and what you want to pay for. I do not believe it should be free. I personally think that owning what you are paying for is very much an important thing. I think that people will respect it more if they pay for it rather than getting it for free. However, I do feel that the cost should be low enough that people aren't feeling financially burdened to carry it. Now, again, I feel it should be completely a choice, that it should be totally a decision to want to carry it or not carry it. And if they choose to not carry it, then they bear the financial burden of paying for it if something should happen. However, I do feel that keeping the cost as low as possible to, one, be able to maintain the system so it is not pulling money from the federal government, but it is completely self-supporting. That the money that is going in is not just paying for the system to be able to maintain, but also to grow and to become better. I'm not looking at this as a complete replacement of the private medical industry. No, I'm looking at this as a supplement. That this is something where people can choose to want to carry either in addition to private insurance, or if they want to carry it as their sole insurance, I guess you could call it, or sole type of coverage, they can choose to do so. As in many other countries in the world, there is both the state-run medical coverage, and then there is also the private coverage. And I think that the marriage of the two, one intersecting with the other, can allow people to really choose if they want to have their own doctor or they want to have a doctor provided for them by the state. Now, obviously, there is going to be cost-cutting measures that are going to be needed in order to keep this. So there will be, say, longer wait times for services because there will be probably a larger amount of people to have to sort through. However, with progression, and as more people hopefully would get into the system, by keeping that cost low, not artificially low, but low enough that it's able to allow people to not feel burdened to carry it. But as the system will grow, the capabilities of the system will expand, but it will not be done on credit. It will be done all with cash. So, without further ado, let me just explain where I'm thinking. There would be three levels of coverage. One, you would have zero coverage, zero, zilch, nada. That means you are electing to not carry any sort of coverage. This would not be a everybody has to enroll type system. You must enroll or you will get fined, you will get thrown in prison. No. This is a totally selective thing. If you want to choose to enroll, you can do so. The majority of this would be done online. However, for those of us that do not interact with computers very well, there would be a in-person system set up in place. I want to try to keep it simple. Again, I can't stress that enough. I want to keep this simple. I feel that keeping it simple will allow people to really enjoy the process of it rather than it becoming a burden to them. I don't think that one's health should be a burden unless you choose to make it such. So the other two options, the remaining two options, would be a emergency-only plan and a full coverage plan. I'll start with the emergency-only plan because I feel that's the best way to get this ball rolling. I've drawn out this system. This is basically just the rough layout of what I feel could be offered. These are the age brackets that I feel things could be stipulated into. Obviously 0 as a newborn to 18 years of age, 19 to 55, and then 55 years old and older. The pricing breakdown is a flat rate. For a healthy non-smoker, non-drug user, that's what this column is entailing. If you're a smoker, drug user, if you're overweight meaning you're not like 5 pounds overweight. I'm talking about obese. That means chubby kids, that means fat adults, and that means people that are bedridden because of their weight are falling into this category. These categories and others, because there would be other stipulations, these are just the majors, would be stipulated by a medical physical, which would be required in order to gain access to the plan itself. There would be a physical involved. A small fee for that would be charged, but it would be minimal. But if you want to gain access to it, you would have to go through that check-in process, so to speak, which would include a physical and a blood test. The blood test is to determine nicotine, aka being a smoker, and that's within a certain amount of time from when you enroll. A drug user, yes, this would be open to drug users. This plan would be open to drug users, people that elect to take drugs. When I say drug users, I'm talking about narcotics. Overweight, people that choose to continue to feed themselves way more than they should, eat more than they should, etc. And obviously alcoholics. I don't feel that excluding anybody based on their personal choices is the right thing to do. I think that the amount of alcoholics that are out there, they choose to be alcoholics. It's a choice. I don't know whether you want to argue that or not. I feel it's a choice. But going to these pricing plans, these are a flat rate. This is not based on exactly your age, exactly your body type, your height, your weight, etc. Obviously excluding being overweight or obese. These are flat rate. So a newborn that's healthy, or a newborn that maybe has some complications, but the parents are choosing to elect for the emergency only plan, $35 a month, flat rate, per person. And these are all per person. So if you have multiple children, this would be $35 per. $60 a month for 19 to 55, and 55 plus 85. If you fall into any of these categories, in any of these age brackets here, the price goes up by 3. So 85, that would be $255 a month, because you're choosing to be overweight. If this is overweight due to overeating, if you're a drug user, you're choosing to put yourself at a higher risk. So I feel that the higher risk should come with a higher cost. This is just my personal thoughts. Now, the times 3 is just a rough estimate. If it's going to be times 2, whatever it might be, but it would be a flat rate. It would not be a per person, per situation. It would be, this is what the cost is. It's like going to a fast food. You have set choices on the menu. There's no real tailoring exactly what you get. You get what you're offered. Whether you want to choose to take it or not, it's all about keeping it simple, remember. So these are the core benefits of the emergency only plan. And the reason why I start with the emergency only plan is simply because I feel this is where most people get insurance and medical coverage is for emergency only situations. The majority of people don't want to go to the doctor. And that's obviously apparent because people show up to the ER because they don't want to go bother their doctor, or they don't want to go to the doctor because the lines are too long. Well, it backs up the ER. So the emergency only situation would not be for regular coverage. It would not be for a head cold. You go to the emergency room. No, you would be turned away. This is for very certain situations that are deemed emergencies. Life-threatening, limb-threatening, etc. So the basic, rough, core coverage options that I feel would be included in this would be nationwide access to emergency services at the federal facilities. And when I say federal facilities, this does not mean every individual hospital. This means places that are set up for this system, for the federal emergency system. Surgeries relating to emergencies would be covered. There would be a $300 copay on surgeries. Now that's per surgery. So if you have 3 surgeries that it takes in order to get back to where you need to be in relation to this emergency only situation. If there's 3 separate surgeries, then you would pay a $300 copay per surgery. And then, of course, because this is completely optional, and I do not feel that this type of system should be shoved down anybody's throat or a fee charged for it based on choosing to not elect, you can opt in and opt out as desired. What that means is that if you choose to opt out, then you can do so. However, if an emergency was to happen or found to happen when you are not covered, you're paying out of pocket. If an emergency happens when you are paying for coverage, or when you during a time, and this is in monthly blocks, you pay per month. So if you in January say you want to opt in, great, you're in, you're covered. February, if you don't pay for February, then this is a flat rate per month. So if you jump in at halfway through February, you're not going to be paying half of this rate. You're going to be paying the full rate for the month. But you can opt in and opt out as desired. And as you can see, the arrows are for all age brackets and all brackets as covered. On to the full coverage plan. This is not a replacement, but this is a supplement, but it would be a replacement to traditional single payer. This would be the federal version of single payer. Again, you have it broken up into 0 to 18, 19 to 55, 55 plus, and then you also have your higher risk categories as a smoker. And then this price is times 2. I feel that the cost that needs, if you're going to be paying for full coverage, yes, you will be paying more per person, but you're going to be getting access to more. The price for this, I feel, should be higher because there will be more people who will want to get coverage who are higher risk, but the price still needs to be low enough that they're not feeling like they're being completely gouged. So if you have a 55-year-old person who is a smoker and is overweight, he'll be paying $200 per month, or she'd be paying $200 per month. The same. So basically, with this, you'd be getting the full cover in the full coverage. You'd be getting access to all of this in the emergency only plan, plus what you get here. You'd be getting opt in and opt out as desired, so per month. So if you want to opt in, pay for it, etc., you're covered. You get 2 doctor checkups per year included. There is no copay for that. That is part of your plan. 2 doctor checkups per year. You got access to lower cost pharmaceuticals. This is not all pharmaceuticals. This is not specialty for things relating to, say, smoking, drug user, rehabilitation, medication, etc. Weight loss control for people who are deemed overweight by their own doing, or any sort of medication related to personal choices when it comes to health. But you'd get access to lower cost pharmaceuticals, and then you get nationwide coverage, of course, at federal facilities, and that includes surgeries, that includes emergency situations, and that also includes checkups. So if you are on vacation and you want to get a checkup, you'll simply log in online, because this would all be web-based for the most part. You check, and then you can check in for a checkup. So while you're out of town, on vacation, traveling, working, etc., and you need to do a checkup, then you can do so, as long as there's a spot available. I try to keep this simple, and I know this video is quite long, but I feel that the options here can be quite broad, but they need to be limited enough that it allows the system to not be running in the red. It seems like there is this constant running in the red with any sort of government policy. With it, you have to continue to use money, otherwise you're not going to get it. No, this is completely based on how many people are involved in the system. That's the reason why the prices are, in my opinion, low for what you get. So whether you choose to do the 0 coverage, the emergency only, or the full coverage, I feel that offering these to the American people, and this would all be based on this is open to anybody. When I say open to anybody, that this is not based on nationality. This is not based on legal status. This is open to anybody. So I don't think that healthcare should be based on where you come from, or your national or your legal status. This would not be free. I can't trust that enough. This is not free. This is about owning what you're paying for. If you want to choose to pay for private health insurance, you can do that in addition to this, if you get benefits that are not offered here. This is not a full course meal. This is a simple offering to people, to give people who cannot afford higher priced private medical insurance access to it. This is not going to be low grade. This is not going to be third world country medicine. This is going to be top tier American medicine, US based customer service, etc. Obviously it's a plan. It's just a rough plan right now, but this is just my thoughts on the matter. So again, emergency only plan, full coverage plan, or you can have the zero coverage plan, where you choose to have nothing. That means you're paying out of pocket. Obviously lots of money. But for a small amount of money per day, it can be saving you a lot of this, lots of dollars. So that's what I feel we can do as a nation. But we can start small, and state by state, we can continue to have something that I feel could be beneficial in the long run. Thank you very much for your time. If you'd like to leave any sort of comments or such below, I'd be open to hearing them. I won't be able to check in on this very often, but yeah, I just wanted to post this because I felt that I just wanted to share my thoughts on the matter, and I'd like to see a system that is better come to light. So thank you very much for your time. Have a great day, and I'll talk to you all later. Have a good day.